Breathing is the process that brings oxygen into your lungs and moves it throughout your body. Our lungs remove the oxygen and pass it through our bloodstream where it carries off the tissues and organs that allows us to walk, talk, and move. Our lungs also take carbon dioxide from our blood and release it when we breathe out. These are the parts and function of the respiratory system. The sinus are hollow spaces above the bones of your head. There are small openings connecting to the nasal cavity. The sinus help to regulate the temperature and humidity of the air as you breathe, as well as to lighten up the bone structure of the head and give tone to your voice. The nasal cavity, or the nose, is the best entrance for the outside air to your respiratory system. The hair inside the nose are part of the air cleansing system. Air can also enter through your oral cavity or mouth, especially if you have a mouth breathing habit or your nasal passage may be temporarily blocked. Adenoids are overgrown lymph tissue at the top of the throat. When your adenoids interfere your breathing, they are sometimes removed. The lymph system, consisting nodes or knots of cells are connecting vessels, carries fluid throughout the body. This system helps your body resist infection by filtering out foreign matters, including germs, and producing cells. The tonsils are lymph nodes in the walls of your pharynx. Tonsils are not important part of the germ-fighting system of the body, and if it become infected, they are sometimes removed. The pharynx, or throat, collects incoming air from your nose and passes downward to the trachea or your windpipe. The epiglottis is a flap of tissue that guards the entrance of your trachea. It closes when anything is swallowed that should go to the esophagus and the stomach. The larynx, or the voice box, contains your vocal cords. When you breathe in and out, it creates a voice sound. The esophagus is the passage leading from your mouth and your throat to your stomach. The trachea, or the windpipe, is the passage leading to your pharynx to the lungs. The ribs are bones supporting and protecting your chest cavity. They move a small amount to help the lungs to expand and contract. The trachea, divided into two main bronchi tubes, one for each lung. The bronchi in turn subdivide further into bronchioles. The right lung is divided into 3 lobes or sections, while the left lung is divided into 2 lobes. The pleura are 2 membranes that surround each lobe of your lungs and separate the lungs from your chest wall. The bronchial tubes are aligned with cilia, like a very small hairs that move in a wave-like motion. This motion carries mucus, or the sticky phlegm or liquid, upward and out to your throat, where it's either coughed up or swallowed. The mucus catches and holds much of the dust, germs, and other unwanted matter that invaded your lungs. Your lungs get rid of the mucus through coughing. The diaphragm is the strong wall of the muscle that separates your chest cavity from your abdominal cavity. By moving downward, it creates a suction to draw in air and expand the lungs. The smallest section of the bronchi is called the bronchioles. The alveoli are very small air sacs that are the destination of the air that you breathe in. The capillaries are blood vessels that are embedded in the walls of the alveoli. The blood passes through the capillaries, brought to them by the pulmonary artery and taken away by the pulmonary vein. While the capillaries, the blood moves carbon dioxide into the alveoli and takes up oxygen into the air in the alveoli.
How do we breathe? Breathing starts when you inhale air into your nose or mouth. It travels down the back of your throat and into your windpipe, which is divided into air passage called bronchial tubes. For your lungs to perform their best, these airways need to be open. They should be free from inflammation or swelling and extra mucus. The lungs. As the bronchial tubes pass through your lungs, they divided into smaller air passage called bronchioles. The bronchioles end in tiny balloon-like air sacs called alveoli. Your body has about 600 million alveoli. The alveoli are surrounded by a mesh of tiny blood vessels called capillaries. Here, oxygen from inhaled air passage into your blood. After absorbing oxygen, blood goes to your heart. Your heart then pumps it through your body to the cells of your tissues and organs. As the cells use oxygen, they make carbon dioxide that goes into your blood. Your blood then carries the carbon dioxide back to your lungs, where it removed from your body when you exhale. Inhalation and exhalation. Inhalation and exhalation are how your body brings in oxygen and gets rid of carbon dioxide. The process gets help from a large dome-shaped muscle under your lungs called diaphragm. When you breathe in, your diaphragm pulls downward, creating a vacuum that causes a rush of air into your lungs. The opposite happens with exhalation. Your diaphragm relaxes upward, pushing on your lungs, allowing them to deflate. How does the respiratory system clean the air? Your respiratory system has built-in methods to keep harmful things in the air from entering your lungs. Hairs in your nose help filter out large particles. Tiny hairs, called cilia, along your air passage move in a sweeping motion to keep the passage clean. But if you breathe in harmful things like cigarette smoke, the cilia can stop working. This can lead to health problems like bronchitis. Cells in your trachea and bronchial tubes make mucus that keeps air passage moist and helps keep things like dust, bacteria, and viruses and allergy causing things out of your lungs. Mucus can bring up things that reach deeper into your lungs that you then cough or swallow them.
Protecting your respiratory system. The lungs are unique organ and part of the system designed to protect them. Mucous membranes line the nose, mouth, and throat, and airways and trap germs, dirt and particles before they enter the lungs. Mucus also stop the foreign matters from the traveling through the respiratory system. And cilia, 10 years, catch dirt and germs and move them up to where they can be a cup or swallow. The lungs are protected by the many defenses, but that doesn't mean that they don't need their person to take care of them. So many people worry about with the heart, the kidneys, the digestive system, and but overlook the many ways that God cares for their respiratory system. It's important to consider the ways that a person can care for their lungs, bronchi and trachea, diaphragm. It is a few simple consideration and can lead to the much healthier respiratory system. Lungs supply oxygen to the blood and remove carbon dioxide and other gases from the body. Anything that can breathe in can directly affect your lungs. It's the connection your heart can affect your breathing. The heart and lungs work together to make sure the body has the oxygen rich in blood it needs to function properly. The pulmonary lobe, the right side of the heart, picks up the oxygen for blood from the body and moves it to the lungs for the cleaning and reoxygenating. The systematic lobe, once the blood is reoxygenated, the left side of the heart and moves the blood throughout the body so that every part receives the oxygen it needs. The close connection between the heart and lungs means that breathing problems can be caused by issues in the ether, the heart of lungs, or both. Pay attention to the breathing and heart functions. Remember that both the heart and lungs can be sources of the breathing problems. See the doctor when something does not seem right.
Symptoms of a heart-lung condition can include unexplained shortness of breath, low oxygen levels, chest pain, near fainting, fatigue, palpitation, heart failure. Common problems related to the heart-lung connection are exercise intolerance, fatigue, irregular heartbeats, sleep apnea, asthma, bronchitis, weak heart muscle, shortness of breath, emphysema, pulmonary hypertension, heart attack.
Interesting facts: 100,000 heartbeats a day, and 1,500 miles of airways, and 5 quarts of blood pumped per day. 16 seconds for blood to travel from the heart to the tooth and back. The easy way to keep your lungs healthy is to consider what you are breathing in. Quit smoking. Smoking is the main cause of lung cancer and chronic obstructive pulmonary disease. Cigarette smoke narrows the air passages in the lungs and make breathing more difficult. It's never too late to quit smoking. Secondhand smoke. Lung cancer and COPD can be caused by inhaling the smoke from other smokers. Just because you are not smoking the cigarette does not mean it's not directly affecting your lungs and respiratory system. Air pollution. Air pollution can cause problems for all people, especially for those with lung disease. Irritation, inflammation, and damage to lung tissue is all possible due to airborne irritants. People with certain jobs, construction, refineries, and unventilated office buildings are also at an increased risk for lung disease. If a job involves large amount of dust, asbestos, or chemicals, proper clothing, mask, and ventilation should be used. Wash your hands frequently. Common respiratory infections like colds and the flu are spread by hands through touching infected surface and then touching the mouth, eyes, nose, etc. by using proper hand washing techniques and washing the hands regularly. The risk of infection is greatly reduced. Keep the air inside your home clean. Many people take for granted the quality of air in their homes. Thus, chemical cleaners and moisture and pollute the air inside your home. Use exhaust fans in bathroom and kitchen to vent moisture. Keep counters, bathtub, and outer wet areas dry, and wipe away those to control the air quality in your home. Opening windows and letting fresh air in quietly as possible is also important, especially when painting, cleaning, or installing new carpet. Use caution during cold and flu season. If illnesses are going around in your area, avoid large crowds and use proper hand washing techniques and alcohol-based and hand sanitizer. Get vaccinated. Flu vaccination help prevent influenza and other serious infection caused by the flu. Getting vaccinated protects the lungs by preventing the infection that can cause damage to lungs and lung tissue.
Having a physical visit with your doctor regularly for a checkup is a proactive way to prevent lung disease and detect problems in the early stages. By being honest to your physician about your health, the changes in your body, and new symptoms, with that, your doctor will be able to complete the testing and prescribe you the proper treatment. Educating yourself and your loved ones about the respiratory health is the key to maintaining a healthy lungs. Breathing is required for life but often taken for granted. Knowing the many ways that a person can take care of the lungs is the key to prevention of the disease and easy breathing for years to come, as well as ensuring quality of life for future years.